A 28-year-old woman, Gravida 2 Para 1, presents to the emergency department at 36 weeks of gestation with complaints of sudden-onset severe abdominal pain, vaginal bleeding, and decreased fetal movement for the past hour. She denies any trauma or recent contractions. Her pregnancy had been uncomplicated thus far, with no known medical conditions. On examination, her blood pressure is 90/60 mmHg, heart rate is 120 per minute, and there is significant tenderness over the uterus. The fundus feels firm, and there is no uterine relaxation between palpations. Fetal heart tones are absent on Doppler ultrasound. Which of the following is the most likely diagnosis? A. Uterine rupture. B. Placental abruption. C. Preterm labor. D. Vasa previa. E. Chorioamnionitis. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. The correct answer is B. Placental abruption. Placental abruption is a condition in which the placenta detaches from the uterine wall prematurely, causing maternal hemorrhage and often leading to fetal compromise or demise. This patient presents with sudden-onset severe abdominal pain, vaginal bleeding, uterine tenderness, and absent fetal heart tones, which are classic signs of placental abruption. The firm uterus and lack of uterine relaxation suggest concealed hemorrhage. Hypotension and tachycardia in the mother indicate hemorrhagic shock. Why not other options? A. Uterine rupture is a catastrophic complication typically seen in women with a history of prior cesarean section or uterine surgery. This patient lacks those risk factors, and while uterine rupture can present similarly, the absence of contractions and other signs favor placental abruption. C. Preterm labor would present with regular uterine contractions and cervical dilation, but it would not explain the severe abdominal pain or absent fetal heart tones. D. Vasa previa presents with painless vaginal bleeding that occurs after rupture of membranes, and fetal heart tones would typically be detected before fetal exsanguination. This patient has painful bleeding with no known rupture of membranes. E. Chorioamnionitis involves uterine tenderness and infection, but this patient has no fever or signs of infection, and her primary presentation of sudden bleeding and fetal demise is more consistent with placental abruption. Key takeaway. Placental abruption is a medical emergency that involves premature separation of the placenta, leading to maternal hemorrhage and often fetal demise. Risk factors include hypertension and trauma, but it can occur without these in a previously uncomplicated pregnancy. Diagnosis is clinical, and immediate intervention is required to stabilize the mother. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.